Hello people, my name is Dr. Matthew Ojaruwedi and I'm here to give a short talk on prostate cancer. First of all, I'd like to start by talking about what the prostate is. The prostate is a small gland found just beneath the bladder, and it's a gland that produces some fluids which are a part of man's semen, and the gland also is involved in pushing out the semen when sperm needs to come out. So what's cancer? Cancer is an abnormal growth of cells which lead to abnormal proliferation. So what's prostate cancer? Prostate cancer is an abnormality in the growth of cells in the prostate gland. Because there's no specific cause for this cancer, and most cancers really, there are risk factors, and risk factors are things that you could do that could predispose you to coming down with any of these cancers. So for prostate cancer, risk factor number one, older age group, over 50 to 70 years. So from 50 years of age, the gland begins to enlarge. From this enlargement, men begin to experience some certain symptoms which is associated with difficulty in passing urine. Do all men have prostate cancer? No. Do all men whose prostate are enlarged have prostate cancer? No. Research has shown that 7 out of 10 men have enlarged prostate. So what do? We need to investigate this very quick. As an old man, when the prostate begins to enlarge, that stream is not as strong, is not as powerful as it used to be. So there's weak stream, there's intermittency. What that means is that the man with an enlarged prostate begins to go to toilet more frequently to pass urine. And there's also straining. The man begins to strain to pass urine. And then there's terminal dribbling. The man passes urine and feels like he's done, but there's still some urine. When he's about going back to his rest place, he realizes that he's soaking himself. So that's terminal dribbling. There's also incomplete emptying, incomplete voiding. The man passes urine and wants to go back, but realizes that there's still some urine that he needs to pass. So all these are symptoms that are associated with an enlarged prostate. But you must note that not all enlarged prostates are prostate cancer. So there is something called benign prostate enlargement. Okay, the medical term will be benign prostatic hypertrophy. What that means is that the prostate is enlarged and it gives all of these symptoms. So from a man who is aged 50 years, his prostate begins to enlarge. When he gets to about 70 years, research has shown that 8 in 10 men who are 70 years of age have enlarged prostate. And if they really go ahead to investigate their enlarged prostate, they realize that some of them may have prostate cancer. So what symptoms would differentiate an enlarged prostate from a prostate cancer? A prostate cancer patient would also, in addition to the previous symptoms that I've mentioned, they would have weight loss. They would see that they're losing weight. No matter how much they eat, they keep losing weight. That's one thing they may find. Another thing is they see that they're not feeling like eating. So they're anorexic. They eat, but they just lack the appetite to do so. Another thing that you may find in prostatic cancer patients is that their blood level may be low. These are many more you can find. Ethnicity. People of African descent have been found to be prone to having prostate cancer as opposed to people who are of Caucasian descent. It's also been found that diets like fatty diets in this dispensation in our locality, eating foods with too much fat can predispose a man to prostate cancer. It also been found that exposure to certain elements like that used in batteries can also predispose to the development of prostate cancer. Another very key history in the development of prostate cancer is the family history. So if one's father or grandfather had a prostate cancer, one should be watchful and try to prevent the occurrence of this by looking out for it quite early. So we encourage men who are 45 years older to check their glands. Go to your GP, let them run a test on you, prophylactically. Not like you're feeling any symptom, but just go to know the state of your prostate, the state of your gland. Some of the things that are going to be done for you are the prostate-specific antigen. It's an antigen that is produced by the prostate. If it's above the normal limit, it is a pointer to the fact that something may be going on in the gland. Okay, another investigation that could be done is a prostate scan or a transrectal ultrasound scan. This scan shows the diameters of the prostate, and if it's enlarged beyond the normal limit, it is also indicative that there is something going on in the prostate. The specific investigation that diagnoses prostate cancer is a prostate biopsy. You go to the specialist, that's a urologist to be specific. Urologist takes a bite of the prostate, right? And they send it to the lab and they look at the cells under the microscope and they will see if there are cancerous cells in the prostate. If it's caught early, surgery can actually suffice because it has not spread to every other part of the body. But if it's delayed, surgery may not suffice. There are other options of treatment, which include radiotherapy, chemotherapy. For patients who the cancer has spread outside the urinary environment, more than one treatment option is used, maybe two usually. And the treatment option depends on two things. One, the cancer itself and the patient. So if the patient is unstable, the patient will be managed conservatively until he's stable enough to undergo surgery, if surgery is the option that needs to be undergone. And another very important criteria for the treatment is the cancer itself. So what's the state of the cancer? So we're looking at the patient and we're looking at the cancer. What stage is the cancer? What is the state of the patient? We're just trying to enlighten men to know that there's something called the prostate cancer. It's never found in women. It's only in men. So you may need to get your prostate checked. Go to your general practitioner. If there's anything, you will be referred to a urologist. And your urologist, who is the specialist managing this patient, gives you an informed option, gives you several options of treatment. And he's going to carry you along the process and want you to be encouraged that it's not the end of the world. We're just here to enlighten you that you need to be more aware of what's going on in your body. Do the routine checks of your prostate if you're 45 years old and above. And if you find any of these symptoms, please run to your GP. From the GP, you get a letter to see a specialist. I assure you that you'll be well taken care of. Thank you very much.